I'm a psychologist, but I work primarily with families that experience challenging behaviors largely in their homes. I consult to some school programs, but I think the clinical work that I do the most of is really working with families around kind of building structure in their home, how to manage challenging behaviors as they differ from the school setting. And I know that most of you guys are experiencing a lot of those things right now, so hopefully I can help give you some tips and strategies that might be useful.
So the first question I wanted to ask you is, what, as a behaviorist, what would you kind of reasonably expect that parents are able to do during this time?
Yeah, I think it's a great question. It's a question that I've gotten quite a bit, and a lot of families are overwhelmed with sort of what they should be doing. Um, One thing that I think an important distinction is there is a subtle, especially in this time, yet distinct difference between homeschooling and sort of virtually or distance learning. And I think what a lot of school districts are trying to promote is this idea of distance learning, um, all the while knowing that a lot of our teachers, especially our special ed teachers, have never done this before. So I would say sort of look to them for some support. I know a lot of them are doing their best. And if you're not really sure what or what they're expecting of you, I don't think it's a bad idea to respectfully just kind of reach out to them and say, hey, I'm just feeling a little lost. What are things that we should be focusing on? And I think, most teachers that I've worked with are doing their best to sort of pull things together and try to clarify that. And so we're all sort of, moving through this together. So I think your school team's a good place to start. Beyond that, though, I know I've talked with a lot of parents who have concerns about their kids sort of regressing or in psychology, what we call decomposing sometimes, or sort of moving backwards. Um, and I think that's the biggest place that we need to start, is just helping them maintain the skills that we have. I know it's kind of frustrating to think that they went from getting speech 5 days a week to not, or to just a Zoom session here or there. And so lots of families are concerned that their kids are not making the progress or sort of continuing that trajectory, which of course is a valid concern. But I do think at this point, what we're really expecting is that families can continue to implement things to help our kids use the skills that they already have. Beyond that, to start just to see them use them more regularly and in new settings. And that is progress, right? So maintaining skills, using them with different family members, using them in new settings, that's all a huge part of progress. And so, we call them maintenance and generalization. So seeing kids being able to generalize new skills at home, is a really great thing. And so we don't always have to be pushing new language, but just getting them to use the language that they already have. Or, if it's a behavioral concern around transitioning from, something non-preferred or something preferred to non-preferred or what have you, continuing to build opportunities for them to do that, that's all part of progress. So I think, the biggest closing thought around that is work with what they already have and don't feel pressed all the time, um, for them to be gaining new skills during this time. Like some of us were saying earlier, this is a really scary time for all of us, even as full functioning adults. So imagine how our kids must be feeling. Um, so yeah, I think that's the biggest point there.
So, also, like, you're not necessarily expecting that the full normal behavioral program gets run. And I think sometimes maybe parents aren't even clear exactly what that full behavioral program is and what it looks like and the skills they do have an opportunity for generalizing. So what would you recommend in terms of, like, how do they grab onto, the elements of the plan that maybe they can use for generalization?
Sure. Yeah, thanks. And that was something I wanted to mention, and it slipped my mind as I was talking. But, it takes a really long time to train somebody, to train a behavior tech or an ABA therapist to run an ABA program the right way, right? I still have people that I've been working with for a year that I'm giving them lots of feedback on how to run ABA programs. So we don't, by any means, especially for those of you who have children that are largely nonverbal or minimally verbal or very behavioral, that have more intensive ABA programs, we're by no means expecting you to implement these, large ABA programs. And I would say to some degree, I almost don't want you to, right? And I know you guys families have a lot of concerns about doing things wrong, reinforcing the wrong behaviors. And that very well may happen. That is a very realistic, I think, fear or anxiety. Um, and so by no means, I think, do we expect parents to be able to run these big academic programs. What we do want, again, is to promote the skills that they already have. So talk with, their teachers or their behaviorists about, what the communication system is, what kind of language skills can we continue to work on. I also think pulling skills that your child already has. And it is absolutely okay. And I think it's a great thing to continue to use those skills. So even if you know that they can sort things by color, hand them a stack of straws and ask them to sort them, right? And that's an activity that they can do on their own. It helps build their independence. It keeps them feeling successful. And I think it's going to lower their anxiety in this time of confusion, right? So they can resort to these tasks. If it's putting together Mr. Potato Head, building block towers, sorting items, you might feel like, okay, they've been sorting items for 2 years. How is this helpful? But I think it's building their independence. It's keeping their success. It's keeping that momentum going. So revert to things that that they can do, and having them practice and just keep moving through those skills, I don't think is a bad thing at all.
And do you think that also on some level, like if they're not children who are used to sitting down with mom or dad to work on things, if you go back to something that's known, then you're actually practicing the skill of sitting with mom or dad as well?
Absolutely. So if you have a kid who, we were talking earlier about Legos, or if they like coloring, or if they like cars, um, I think for a lot of us who are professionals, our instant thought is, oh my God, that's great. We could teach so many things there. But for parents who aren't doing this every day, it's a little more abstract for them. But I think absolutely start with things that your kids like. And even though it might seem like a leisure activity, it might not seem like an educational thing. You can easily build in counting, um, labeling, colors, numbers, if they're building with blocks, if they're using cars, if they're using Legos, whatever it might be. And like you said, just getting them to sit and attend and have a conversation with you, right? Just talk about what they're doing, building in opportunities for them to start using more language. Um,
So if they got a stack of worksheets that they're supposed to be completing, it sounds like you're saying that it's fine to turn it into a different type of activity. Would you encourage them, as a behaviorist who likes to collect data and information as well, that if they're not getting the worksheets done, would you still want to like feedback and be able to see, well, we could do this math work under these conditions or things like that to facilitate a team conversation?
yeah, and I certainly can't speak for everybody, and I'm sure there are some teachers that will want those worksheets done, but I from my perspective and most of the educators that I know and collaborate with, we would much rather just have an email from a parent that says, hey, we didn't do this math worksheet, but we talked a lot about numbers and counting when we were using blocks, or when we were using cars, or when we were on the floor doing this or that. I think for me, I would love that email. I would, be totally fine with that. And I think I can speak for a lot of us when I say that, as long as we're reinforcing the skills and finding ways to address them, it's okay if the worksheets don't get done.
So one of the things that we had talked about in our pregame too was that life skills are also really important to focus on right now, as opposed to being really heavily focused on some of the academic work. What kinds of life skill opportunities would you want the families to be looking for?
Yeah, and I think, like I said, tasks like sorting or things like that, they sometimes, if they're written in an IEP, they look very academic. Sorting by color, sorting by shape, identifying objects. You can build those things into so many daily activities. So again, taking the things that your kids know how to do, and then having them do those things with you sort of in different areas. So for example, I was working with a family on loading the dishwasher. Like the forks go in this one and the spoons go in this one, and then unloading it. Or um, sorting laundry, right? If you do like darks and lights, have the kid come in with you and hold them up like, is this dark or light? Right? So it's a nice opportunity to take some of those academic skills and put them, in a different context, all the while acknowledging that you probably have other kids at home, you've got a house to run. And so, don't think that I'm expecting you guys to sort of do that all day long. That's definitely not the expectation. We get that you have many other responsibilities, but if you could pull out certain parts of the day. So it might just be an hour here, or a half an hour there, and a half an hour there, whatever that might be. And I know we'll talk, other panelists will talk about this later in the week, that kids are not getting direct instruction from 8 to 3. right? If you pull out lunch and recess and all these other times, there's, lots of other periods where it is more free and less structured. So don't feel like you have to be teaching your kids for, 6 hours a day. But if you can pull out those areas where they can help you and generalize their skills, I think those are really great places to do them.
Well, and I think I actually made an interesting point talking about chores. I know a lot of our families, they may not only be getting therapy during the school day, but they take their children to therapy after school as well. And the routine of filling their day with therapies maybe has taken precedence over actually practicing some of those chores and some of those daily household tasks. They've become something that mom just does. But maybe, because there's not an opportunity, or maybe a housekeeper does, or whatever their situation is. But the children may not have been as engaged in some of those chores before, but it can be both. There are opportunities both for, sensory supports and regulations, as well as building in, maybe a totally new routine of being at home that wasn't there before, because it isn't being at home isn't being at school. So do you have any, I don't know, insights or things to build on related to that?
Yeah, and I think just watching time too, I do want to sort of transition to talk about some of the challenging behaviors that we see too, right? Because I do think it's really, ideal to say like, hey, come do this with me or sort this with me. But we know that a lot of our kids are not just gonna be like all willy-nilly about it. I'm like, sure, let me go on the dishwasher with you, right? A lot of our kids are presenting with some significant behaviors, especially our families, again, that have kids that are more severely impacted. And so I think to that end, um, trying to build in as much structure as you can. And I know that's easier said than done, especially in the home environment. But what I tell families is don't be afraid to kind of overprompt in environments like this. So even though that going to the store has previously not been challenging, it's okay to use a lot of first then language, even though they might not need it anymore. But if it was previously successful, I think reverting back to some of those strategies where they found success. So a lot of first then language, let them know what's coming, what they can earn after, or, whatever that reinforcing contingency might be. If they had previously been doing well with visual supports that you've kind of faded out, I think maybe shoot an email to your behaviorist, but my general thought is it's okay to reintroduce those things that have been successful. And there was one more thing I was going to say that totally just went out of my head.
I'm sure it'll come back around,
Yeah,
probably in a different question. So that's okay. So
yeah,
in thinking about those kids where maybe we're not, we're not even at the point where we're just looking to, maintain the skills. Maybe we're at, the behaviors are really kind of taking over our family life right now. And we feel like our child, our child that has the behaviors is suffering, and the children that maybe live in the same house might be experiencing similar things. Uh, do you have any advice for those households that are maybe in chaos, and then they feel like all the attention is on that child and they can't help their other children even get their schoolwork done?
yeah. And, in a lot of ways it's hard because these situations are so individual, right? We know that behaviors always have sort of different functions and they change from child to child frequently. But to that end, I think, and Dr. Cohen talked a little bit about this last week, behavior is communication almost always. And so our kids are almost always trying to communicate something to us, especially our kids who are more language impacted. So if they have very minimal language, they can't communicate sort of what's bothering them or their anxieties or fears or their even just basic wants or needs or sensory discomforts. So parents generally know their kids best. And so trying to identify what might be triggering these behaviors. And then, we talk a lot about proactive strategies, right? So things that you can do to prevent behaviors from occurring. So if you know that a certain activity is going to be triggering, I would say either avoid it as much as you can, right? Trying to avoid stimuli that is going to promote those behaviors, or again, really sort of building structure, lots of reminders around those times. So letting them know what's coming next as much as you can, and then scheduling parts of the day. And it could just be as simple as writing it out on a whiteboard, right? We're not expecting parents to like come up with, extreme plans or schedules here. And then on the other end of things, so when these behaviors are happening, which I know can be really scary. My go-to is always safety first. To that end, though, if it's not a dangerous behavior, so if they're not headbanging, if they're not becoming aggressive or something like that, take a breath and walk away for a second, because I find that as parents get louder, kids then get louder, and then one anxiety goes up and the other goes up, and it becomes, especially in the home, it becomes this really chaotic and scary time, I think, for the parent and the child. So what I usually tell parents is if it's not a dangerous behavior, take a breath, step away for a second, and then come back to it. If it is, we want to, of course, do our best to keep our kids safe. And so what I would say, especially for if you have typically developing siblings or higher functioning siblings, talk with them about things that they can do or sort of go do if you have to deal with a really serious behavior. So maybe it's like, hey, go work on that puzzle that we were doing earlier, and then find time to then go interact with them. It really is a balancing act, and I think it's, can be really challenging for a lot of our families. But if we can promote things that siblings can maybe do independently while we sort of deal with these immediate safety concerns, and then, build time to try to, give some attention and time to the other siblings. I think somebody
Yeah.
posted,
Oh.
yes, I was going to talk about social stories. Thank you, Aileen, for that. And I think those are a great place to, again, just sort of build in some basic scripts around what's expected, what's coming next, things like that. And they don't have to be long stories. It can just be, a picture in a couple sentences or something that you could sit and read with the child.
So it sounds like you're also encouraging parents, if they have multiple children, like have a family meeting, essentially set up, a contingency plan so that everyone's kind of working together too. And maybe if you have that routine, you don't have to, you can say, remember what we talked about before, let's
Yeah, and of
basically
course,
engage the plan.
right. And of course, it depends on the age of the kids and, the ability levels of the other children. But what I do with almost all my families is we safety plan, right? Here are the behaviors that we're dealing with right now, especially if they're aggressive or dangerous behaviors. Here's what we're dealing with. Here's how we're all going to do this together. And if you have older siblings that can kind of help support that, that's great. If you have younger siblings, sometimes it's just more challenging, but we safety plan. This is what we do as a family when this is going to happen. And that way everybody kind of is on the same page, and it reduces this idea of chaos. And again, I think, trying to block the injury or the aggression as much as we can, but then also trying to promote communication, right? I think parents get really burnt out trying to deal with these challenging behaviors and forgetting that there's a reason why they started. So if you can then try to get them to elicit what it is they're trying to communicate, and then do your best to reinforce that, that's going to, reduce the likelihood of this in the future, which is sort of very behavioral jargon. But I think if we're just talking about, sort of broad tantrum behaviors or things like that, again, there's usually a reason why they're happening. So trying to identify what those reasons are.
So would you say also that, maybe the communication board might be limited for this particular problem that we're facing right now?
Yeah, and I think, as all of us know, emotions in general are really hard to teach because they are complex, right? It's not as easy as just happy, sad, and mad. Those are great starting places, but I think a lot of us are feeling complex emotions that we can't even label. So imagine how a lot of our kids are feeling. And yeah, so those are really challenging things. What I think is helpful sometimes too is to find activities that our kids really like, and it doesn't have to be the most reinforcing. So we're not talking like iPads or video games, and I know we're going to talk later in the week about screen time. But if it's Legos, if it's cars, if it's something like that, if you could recognize their precursor behaviors, we call them, or sort of their warning signs that they're getting escalated, have a few things in your toolbox that you could say, like, hey, it looks like you're getting a little anxious or a little frustrated. Let's go play Legos for a little bit or something. And I also think modeling that language for them, even if they're largely nonverbal, is usually helpful. And sort of putting words to, or just sort of building language around how they're feeling or how you speculate they might be feeling. Parents usually, again, can recognize those triggers or those warning signs.
I do have another question around screen time, and especially because screen time can have so many effects on different children, and sometimes we are using screen time as the reinforcer. it
Mhm.
might not always be the best thing in this particular moment, depending on what's going on in the home. And then also maybe talk to us a little bit about the challenges that might come with doing Zoom sessions with kids.
Yeah. And again, I think you're talking tomorrow about screen time, or some other folks are later this week.
Mhm.
Um, I do think if there are activities that you just have to do that are historically very challenging. So like for some kids being in the car, but like if you have to stop and get more toilet paper, if you're not one of the people that is stocked up, if you have to go to the grocery store or something like that. I will tell families, like, if transitioning away from it is not a huge problem, I think it's okay to give them the iPad if you're in the car or something, right? Because it's gonna occupy them, and it's gonna make your life a little bit easier. And so I do think there is sort of a give and take with that. And that's just my opinion. Certainly others differ from that. But I do think if there are times where it's more appropriate than others, just for the sake of like getting through this, right? As a family, kind of getting through the stress of all of this, I do think it's okay to a degree for some of those times. Um,
What if screen time is the thing that makes them sit down, but on the back end maybe creates more behaviors than they anticipated?
Yeah, I think, and we call it a preference assessment. You can do something sort of more informal, but just, or even thinking as a parent, like, what are the things that they like the most? And if the iPad's at the top of it, what comes sort of right below that? Try to use those activities first. So when they're sitting at the table, can you get them to engage with things like that? And then a lot of families I work with, screen time, we only just allow at certain times. And our kids are sort of conditioned now where it's not allowed until like after they get home, or the second half of the day or something, in times like this. Um, and for other families, they've taken out screens altogether, which I know in this time is just not very realistic. Um, but I think you have to gauge what your child's reaction to, or what your child's reaction is to having to transition away from it. And sometimes that creates a much bigger problem than using it to begin with. So I think unfortunately it's just really individual, and it just kind of depends on the child. But um, to that end, if you're willing to sort of give it a try or see how it goes, again, build in reminders, build in structure, use timers, give them transition warnings. Also, if we're working to promote communication, if I have a kid that says, "Can I have 2 more minutes?" I usually say, "Yeah, absolutely," because I really like the way that they asked, and we want to promote that, communication building. Um, but yeah, building structure around it as much as you can, using visual timers, things like that.
So, in thinking about some of these Zoom sessions that are now, coming online for therapy purposes, um, sometimes that's a boundary crosser for some of our kids, and they're not that open to it. Can you maybe give some thoughts around that, or any strategies you might have?
Yeah, and like we were saying earlier, having sort of providers be, I often go into homes. So for me, I think it's, more normal to see me in their home. But for you, for example, as an OT, it's not as normal for them. So again, social stories might be helpful, just talking about some of the changes, like, we're going to see Miss Aubrey today, but she's going to be, have them be on the computer first. I've had families actually Zoom with each other from different rooms just so they could see what it looks like. And it's almost like desensitizing them to it, because for a lot of our kids, they don't, unless it's FaceTime or something, they haven't really done this before, especially on a computer. So I've had families FaceTime each other just so they can sort of get some exposure to it. Um, again, if a social story might be helpful. Also, I think for some kids, this just isn't ideal. And this, to a certain extent, especially I'm thinking, I've got a 4-year-old that's minimally verbal and very behavioral. I'm not really going to be able to run behavioral programming with that child over Zoom. It's just kind of the reality of it. But what I do is take this as an opportunity for parent training. So let me give the parent a couple things that they could do. I can at least kind of watch how it's going with the kid. And if the kid's just not having it, then I take that time to sit and talk with the parent. How's the week been going? What are the biggest challenges that you've experienced? Tell me the things that are just not working for you, things that I've given you to try that are just not working, things that are working. And I use that as an opportunity to talk with my families about, a parent training time, giving them strategies, or just talking through behaviors, talking through scenarios that have happened. And then, I give them homework, right? Here's a few things to try. Do this for the week. Let's regroup next week. And then, we could talk about it from there. I think, everybody's doing the best that they can, providers, families, everybody. And the reality is that for some kids, this is just not an ideal format. So we're going to make the best of it that we can.
So it sounds like, that I thought that was great advice what you gave with the Zoom kind of pre-gaming with the family. Is that also how you would recommend kind of introducing maybe materials that your child has had exposure to in other places, but is not, used to doing at home, just a little bit at a time, or, doses of information that they've seen in other spaces?
Yeah, for sure. And I think, again, pulling parts of tasks that they've done, and giving them some exposure to that. The other thing I was going to say was ask your providers if, we're all pretty busy right now and we're all, I think, adjusting to managing our schedules and reworking everything. But what I've done with families too is I've scheduled like a 5-minute, hey, how's it going? This is how we're going to talk this week. So just to give kids so they're not overwhelmed with like an hour session. But if they could just get a really quick snippet with their provider sort of on Zoom, whether it's the speech therapist or the teacher or something, and just giving them, a quick opportunity just to sort of get a little exposure to it and then not have to deal with it for that moment. If, you have providers that are available. I have had families that have actually sent their children to other homes, and that's because the parents are like medical providers and they don't want to be coming home and exposing the family. I only have one family that's doing it right now. It's a challenge, right? And I think just because of, having to be home as much as they are, and like just the broad schedule change that they're experiencing on top of now experiencing it all in a different house, is definitely, creating some struggle for families. Jeanette, I don't know if that's exactly what you were asking. But
and maybe I think too, like if they are going to different homes, then obviously even what about your child is going to be really challenging to pass off to a different caregiver and have them learn overnight. So maybe even really just helping them, or you had actually mentioned to me, you have a tips and strategies sheet that you want to share as we wrap up, maybe something similar that they need to create for the people who are caring for their children.
Yeah, thank you. What I usually do when I write a behavior plan for families, I write sort of usually what's like my draft version, just so that I could see sort of my thought process. And then I usually take that and I pull it or put it on like a bulleted sheet that can go on the refrigerator or can go where the parents can see it. That's sort of quick tips, quick strategies, particular to that child. So I think if you are in that situation, having a 1-page guide to like, here are things that don't work, here are things that sometimes do work. And again, pulling on things that maybe previously worked and just building more structure. If they haven't had a token board in a while, but it was successful at one point, I think pulling that out and using it again is not a bad thing. Or if you needed a visual schedule at one point, but you've kind of gotten past that, you could just go through the schedule verbally. It's not a bad thing to pull those visuals back out. Because this, again, their worlds have really been flipped upside down. I think all of ours have. And so pulling out things that we know have been successful, and utilizing them again. And if you could take those things and send them with the other caregivers, to give them as much support as you can, I don't think is a bad thing.
So going back to things that have worked, making sure that you're trying to set the family or whatever caregiver they're with up for success with those contingency plans. I think all of those, any combination obviously would be valuable for any one of our families, I'm sure. And hopefully, if you were listening today, you got a lot of great ideas and some good strategies that you felt applied to your family situation. I just want to wrap up. Thank you, everyone, for coming to this discussion today. Do you want to tell people how to get in touch with you if they need you?
Yeah, so I will send Aubrey sort of a tip sheet with some resources for you guys that she will post with the video. And I'll have my contact information on there. You can also just hop on my website. It's got my email, my phone number. It's Dr. Harry V, so DrHarryV.com. And all my contact info is there. So if I can be of any help, feel free to reach out.
Great. Thank you so much for coming and being our guest today. We really appreciate everything that you brought. We will see you all tomorrow. Have a great day.
Thanks, guys.